So the most challenging issues when it comes to the cancer care in the Gulf region is the awareness and also the fear of cancer. People are not very aware of the symptoms of the cancer and the importance. If they have any symptoms, they have to seek medical advice. In many instances, it will not be cancer, but sometimes these symptoms could be an early signs of cancer. Unfortunately, many patients they ignore these symptoms until they become severe symptoms, and then they go to see their doctor. And at that time, when the cancer has symptoms, that means it has spread and became advanced cancer. It will be more challenging to cure. We know that patients with early cancer, they have a very high success rate of cure, up to 90 to 95%. But patients with advanced cancer, that's stage 4, they could have only 5 or 10% cure rate. So the earlier you go to see your doctor when you have symptoms, which leads to earlier diagnosis. The other issue is the fear of going to see the doctor for early screening. Even if the patient or the public, they know about the screening, they try to avoid going to screening because they're avoiding some procedures, either colonoscopy or mammogram, the fear of having pain, and this will lead also to delayed diagnosis or the inability to diagnose cancer in early stages. Also, there is some stigma about cancer diagnosis. When patients they have cancer, they try to avoid telling others that they have cancer. They try to avoid going to their work or going to see their families or friends, and this also leads to isolation and also cause the anxiety and depression. So we know that around 60% of all cancer cases in the Gulf, according to the Gulf Cancer Registry, they've been diagnosed under the age of 50, and that's a significant number. Also in the UAE, we published our data a few years ago, and we showed that almost 45% of all cancer cases in the UAE are between the age of 20 and 50. And again, this is a significant number of patients with cancer in their younger years. And again, this is because of the reality that UAE population and the Gulf population actually they are younger population, so that's why we see more and more cancer in younger people. So the reality is, patients with cancer, especially the younger ones, they go to see the doctor. Doctor usually they don't identify these patients are being at higher risk of cancer because the classical teaching that cancer affect older patients. So when the younger patients, for example, they have abdominal pain or they have blood in their stool, they go to the doctor. The doctor usually tells them like you're fine, you're young, you'll be fine. But the reality they could be having gastric cancer, colon cancer. So they don't really get the proper assessment, for example, like colonoscopy or CT scan. And again, this leads to the delayed diagnosis. And this is actually very, very common phenomena also in Western countries and the US. There have been many studies showing that younger patients, they tend to be diagnosed later, and also they tend to have worse outcome because delayed diagnosis. So the way that we treat cancer is, number one is by diagnosing cancer, making sure that this is the right diagnosis, and making sure the pathological diagnosis is correct, and then the stage. Based on the stage, either patient have the early stage or intermediate stage or advanced stage. Based on that, and also based on other testing called molecular testing, where we check the genes and then decide what's the best approach for patient. For example, some patients with breast cancer they only get surgery, others they get surgery with radiation, others they get surgery, chemotherapy, radiation, immunotherapy, targeted therapy, chemotherapy, and again depends on the type of the cancer and the stage of cancer, which will also affect the decision. Very important as well to have to decide based on the patient functional status. For example, older patient with heart problems different than younger patient, no issues, so the intensity of the treatment also will be different. Well, the advancement in the cancer treatment happening now actually is the genomic medicine or personalized medicine, where each patient genes, cancer genes, are being evaluated and tested, and based on these evaluation, we give the patient personalized treatment based on the genetic variation that they have. And again, you could have two patients with the same cancer, both patients, for example, colon cancer, but each patient will be receiving different treatment, and this is based on their gene variations and differences. So it's very important for all the stakeholders, including regulators and also the insurance companies, trying to increase the awareness of cancer. Again, unfortunately, cancer will increase over the next 20 years by 100 or 150%. And the only way to combat cancer is by increasing the awareness about how to identify cancer early and also how to adhere to the screening. So by improving the health literacy of the public about cancer, it will be a very important tool to fight cancer. Otherwise, cancer will continue to increase over the next 20 or 30 years. Well, I believe that to improve the health literacy is requiring mass education for the public. We do need to educate the children in school about cancer and also other health problems, and this is the only way where we can increase the awareness. So these children in the future becoming adult, they know exactly what are the signs of cancer. Also, they will be able to choose a healthy lifestyle, avoiding being obese, eating healthy, exercising, avoiding alcohol, avoiding smoking. If you don't educate the public about these issues, people usually they just live their life and they try to enjoy their life to the fullest, and this definitely can have a significant negative impact on their well-being. So education is the key message when it comes to the cancer.